doing well. So we are recording this today just so we have a record of it and people can refer back to it. My name is Annette Marcus and I use she, her pronouns, and I am the policy manager with the Oregon Alliance to Prevent Suicide. And today is our quarterly coalition webinar. These webinars are intended as a way to share news around the state, to highlight some important initiatives, and also to really get a spotlight on what some of our coalitions are doing. Next slide, please. So today, we are going to be just doing this quick agenda overview, and then I'm going to do a little bit of kind of just looking forward, some things that I know they're coming up over the summer. And then I'm really excited we're going to get to hear from Zev Braun in Washington County more about the work that they're doing with their coalition there. I'm going to get a quick update about a very exciting summit that's happening this summer in July. And then I'm very happy to have Leslie Golden here from Lines for Life, who's going to talk with us some about 988. And I asked Leslie really to do a fairly kind of informal conversation with us, because Leslie is on the front lines of trying to get is getting 988 into action and moving forward at Lines for Life. And there's a lot of moving parts. And I think it's just helpful for all of us here to have some sort of understanding of where that is. And then finally, want to share with you in honor of Pride Month, and also as we look towards this next year, both some update and thinking around how coalitions and all of us working in suicide prevention can be supporting the LGBTQ community. And here's some kind of good news from Chris Bifulco about sort of the amazing work that's happened around the state with our LGBTQ mini grants through funding from OHA that we at the Alliance and AOCMHP got to push out across the state. So next slide. So just taking a moment to think about this coming year. As many of you know, we, the Oregon Alliance to Prevent Suicide, set our policy agenda in June. And one of our priorities is to really support efforts to have suicide prevention funded across the lifespan in Oregon. So there'll be work this legislative session to try and push that through. We are working on exploring legislation to require training for medical providers. We're finding that to be very complex, and super interested in any of you who are interested in that issue, getting more involved with us. Please feel free to contact me. My name will be at the end. But we know that our medical providers, whether it's primary care or an emergency room, being equipped with an ability to really screen and appropriately support someone who is suicidal is an incredibly sort of important part of the fabric of prevention and intervention. We will be continuing to support the 988 mobile response implementation. And then we also approved kind of a variety of things that are around creating protective environments. So everything from supporting safe storage and promoting a Good Samaritan clause around lethal means, to really pushing for equity to be centered in our trainings and taking a look at the way that we're getting our data for LGBTQ use. So sort of a whole array of issues that are focused around creating a more protective environment for folks. 988 comes online in July, more today on that. Most of you have heard this news already, but I will just share the very good news that OHA responded to the request that we, the Alliance, put in on behalf of all of you to provide increased funding to local coalitions to do their work. We are not clear on the exact amount, but it's somewhere in the neighborhood of a total of $400,000 to $500,000 that will be available for small mini grants across the state to coalitions. And this summer, we are really going to be working on the process for selecting those grantees. The intention is that all of our active suicide prevention coalitions should have an opportunity to receive some funding to support activities that they're doing aligned with the Youth Suicide Intervention Prevention Plan. Again, if this is something you're interested in providing input into the process and how we think about it, we'd love to hear from you. Just out of curiosity, we can do a raise of hands or little signs. If you are you engaged with a coalition, a suicide prevention coalition? So you can either use one of your little signals, or if we can actually see you, raise your hand. See Janine, Abby, Shane. Okay, Jacob. All right, it's interesting to see. Okay, thanks. And then finally, we are going to be in August sharing out across the state information about a messaging campaign. I see Scott Vu is here. Scott is really helping us to lead up this work that we're doing around having more shared messaging for our September Suicide Prevention Month. And so look out for that, or if you're interested in being part of developing that messaging, please let us know, and we would love to have you join in with our work. This is really an effort being led by the coalitions. Next slide. I just want to, because the Alliance's focus is really around policy work, I always kind of have this tick, tick, tick of the legislative calendar going through my mind. And just a reminder for any of you who are also tracking legislation, we are working towards a long session, which will start in January 17th. If you are supporting or working on legislation, really, we now have between July and, let me give you the last, September 23rd is the last deadline to request a legislative concept. And so just kind of have that in your mind as you're thinking about the legislative year. And keep your eyes out in December and January, because there will be legislative committee days, and it is sure to highlight a number of the priorities for the upcoming year, which we expect will once again have a lot of discussion around mental health funding and suicide prevention, et cetera. Next slide, please. So with that very quick run through of sort of where we are today, I am happy to pass the torch on to Zev to share with us some about the coalition in Washington County.
Thank you, Annette. Do you want me to just share my slideshow with the group?
That would be awesome. And then be sure to send it to us so we can share it out with folks afterwards. We'd love that.
Yeah. Okay, starting now. Okay. Can everyone see the first slide of the presentation?
It's kind of blacked out. I don't know if your slide, if it's showing that way for everybody else, but I don't see any words on it on my end.
Interesting.
But there's words now.
Uh-huh. I tried to...
Now there's words and pictures.
Okay. Huh. as soon as I do presenter view, it doesn't work. Weird. Okay, what I'm gonna do is just not use any notes because I don't really need them, to be honest. So Washington County has a suicide prevention coalition called the Suicide Prevention Council. It's been in existence since around 2012, 2013. It was formed just kind of based on community member activism, seeking out some kind of way to coordinate suicide prevention efforts in the county, which actually predated my position from existing. The Department of Health and Human Services kind of responded to that a few years after the council formed with a first part-time position as a suicide prevention coordinator. And now I'm full-time. I've only been around though since November. So I got the council together in January and wanted us to try to use the budget that we get every year from the Community Health Improvement Plan, because the council is one of the 5 CHIP, they're called, committees for Washington County. So we get $20,000 a year, which isn't necessarily guaranteed. In fact, this coming fiscal year, that might be not happening, but I'll figure out an alternative. But it was really lucky that we had money, and it was all left over from my predecessor. So we spent it on a couple different events. I had the council vote, and they selected doing public outreach and events as being the priority for the current fiscal year. So I convened a steering committee that didn't really exist before in late March to actually figure out how we were going to do that, and try to get it done by the end of June when the funds would run out. And we kind of went in a couple different directions. We got some ideas from the Oregon Alliance convening a coalition leaders network, which had talked about kind of sign rallies using the signs of hope signs that have been done in a few years past across Oregon. Maybe doing kind of a video project where people on camera would model how to have a conversation, how to check in with someone who may be suicidal or struggling in some way. So we try to do both of those things and advertise it. So the first thing that I'll talk about is the sign rallies. We modeled the campaign after Signs of Hope, which many of you probably have seen before, even if you didn't know exactly what it was. They're really simple, easy to read signs that say things like, just a second, the neighbor is starting a car. Sorry about that. They're really easy to read signs that say things like, don't give up, or you matter. And we wanted to customize them with some QR codes and some hashtags for social media purposes, and have additional text in Spanish. So I came up with some designs just using good old Microsoft Publisher. And it turns out the QR codes are really easy to make. You just use kind of a free website generator to do it. And we selected this hashtag kind of to invite any county to participate in this year or in future years. It had no activity before, so we kind of claimed it, so to speak. And I'd be happy to see it continue in future years.
So
And these
Zev,
are, yeah.
Zev, just to interrupt you, this is, I just want to share that this is really an example of something that didn't exist just 2 or 3 years ago, that a coalition, a local coalition would create a resource that then they would make available to everybody across the state. So it's really kind of for us in Oregon, it's really an innovation and I think an important kind of path forward for how we all together begin to really do some shared messaging and connecting. So thank you. Thank you for that work and the work that all the folks at coalitions have been doing on this.
Yeah, totally. And at one point when these were done, I shared the publisher file that can be edited by anybody, and I'll share it again, because if your county wants to, or your organization wants to do this, all you'd have to do is change the QR code, which I mean, you can just Google QR code generator and do it yourself and input any link to like your resource page or whatever. And then you can send the designs to a printer and they'll print them on signs. It costs us about $10 a sign, which, seemed a little high, but I think the pandemic increased the prices for some of that stuff. They are though like high quality signs. They're made of like a plastic corrugated material that's not expected to deteriorate with like these pretty heavy duty metal legs. So it's a purchase that should like be somewhat sustainable to use those same signs in the future. So after we designed the designs for the signs, that was a confusing sentence. I connected with the epidemiology program in Washington County to determine where suicide kind of incidents were occurring as kind of like hotspots in the county, so to speak. And we looked at some data that I was given temporary access to and identified these locations in the county, which also tend to fall where there are more people living. I was a little surprised there wasn't any much of any suicide activity in rural areas, but that's a different conversation. So what we tried to do was using this kind of flyer on the right that I had some coalition members make with me. Donna Marie Drucker is also really involved in the Oregon Firearm Safety Coalition, but she lives in Washington County, so she's on my council. And we worked together to make that and kind of develop this model. I think it was her idea that worked really well, where instead of us trying to directly coordinate specific rallies and then hold them and manage volunteers and stuff like that, instead we were the ones managing the hosts, aka a nonprofit organization or a government kind of program within one of our departments or whoever wanted to do this really. And they would be responsible for coordinating their own volunteers or coworkers for the rally. Our job was to give them free signs to use and keep. And I wanted to also give everyone snacks and water for those days of the rallies, thinking May would be a little bit warmer than it was. I thought people might get hot and want some refreshments, but it ended up working really well because we only had to work with those hosts, of which there ended up being quite a number, probably about 15 or 20. But the events in general had, I think, over 150 volunteers. So we didn't have to do that directly. We just kind of facilitated it happening. And we specifically said on the flyers and our communications that they get to keep those signs. That's kind of their incentive, other than just being good people, is you can put this in your yard, you can put it in your local business or whatever. And that will get to spread that message into the future. So we ended up having over 30 rallies in the county with, again, lots of volunteers. It occurred over about a month, and just got a lot of really great feedback. This is just one of many snippets of kind of responses from people. It says, participants were moved as children waved at us from their car seats, truckers blew their horns, and police and fire trucks gave us a blast from their sirens. There was people coming up on the street, pedestrians saying thank you, some even like joining in, some tearing up or bringing flowers. We even recruited some high schools to participate. And all in all, it was mostly the sign printing that cost money, but other than that, it was volunteers with a couple snacks. So it was a pretty cost-effective way to really do kind of a public event for a lot of people to see and participate in. And of course, like, just because a driver sees a sign one day or maybe 2 days in a month, it's not necessarily going to change them in a meaningful way. I mean, it might, but it might not. However, all those volunteers really did get a change in kind of their perspective. They got to see like how impactful it could be to just stand on a street for a couple hours with a simple message of hope. And I think that is much more valuable. With those 300 signs we printed, a lot of places are going to put them up more permanently now that the rallies are over. The jail, the sheriff's office locations, nonprofits, people's residences. These are some pictures, just made a collage. People would sometimes send me pictures back from the rallies as part of their kind of, I guess, report. Not that I necessarily asked for one, but it just got a lot of really good attention. On the bottom left and right, that's one of the high schools in the county that the students were so excited about doing this. They did it, I think, during like the lunch hour, that they want to do it like every week now, which they can totally do if they want to. Yeah, maybe I guess I could real quick stop and just see if anyone has questions on that before I move forward, but it's okay if you don't. I highly encourage folks to do this in the future if you haven't, or if you have, to just keep doing it, because it seemed like a pretty easy way to get folks engaged.
Yeah. Sev, I'm seeing a lot of excitement. One thing I think is interesting is that suicide prevention is organized so differently from county to county. Are you just thinking about, are you a county employee doing this, or just if you can say a word or two sort of about how you're constructed in that way?
Yeah, I'm a county employee, technically the suicide prevention coordinator. And because this was the council's decision to do, as being one of the chairs of the council, I'm kind of in charge of like making their ideas happen. It is the kind of activity that doesn't have as much of a structural change. Of course, it can change culture perhaps to some extent, or like people's willingness to have those conversations with each other. But there's also like a force telling me like I need to get involved in policy and systems and stuff, which I totally agree with. But personally, I kind of think that both are important, even though these events don't like, you can't measure numbers here and say like this many people like averted a friend or someone changing their willingness to attempt suicide or whatever the case may be, just based on the number of positive responses. I mean, unanimous positive responses. It really seemed like it was important, and especially if you can kind of offload the work through like using hosts to organize their own volunteers and finding a pretty cheap way to handle it. It seems like it could be put into a broader strategy that's more based in like, how do we make mental health care more accessible, or how do we make training more standardized for all people working in healthcare, social services, things that are more systems level. So those are kind of the things I was wrestling with when I was doing this and some other stuff.
I think it's such an interesting example of how our work is both huge and incremental, because what you did was huge there, and you're recognizing that it's a piece of a larger puzzle. And it's sort of us putting all these pieces together that make it work. I don't know if you saw Alyssa asked you a question about, Alyssa, do you want to just pop in and ask it? Or I can just read it to you, Zev.
Okay.
She said,
Sure.
there you go.
You know, just as somebody who's so connected to our QPR work, I'm just curious the extent to which your sign holders are prepped to respond if they do identify folks. Yeah.
Yeah, we thought about that, but because of the timeline, there wasn't time to like get volunteers trained in advance. And what I told people was like, if someone approaches your group that really seems like distressed, try to get some contact information and tell me about it, and I will do some follow-up or connect people to follow up with them. That didn't happen very much, I think, because people aren't walking around too much. At least not now. Summer's here, so maybe that will change. But it was mostly drivers that would maybe stop to wave or say something, but they weren't. It wasn't much of a chance to like interact. The people that did stop on the street, though, they were very passionate, and for the time being, that was like all I could really offer. That's a great point. It can kind of lead people to have pretty deep thoughts when they see those messages. Something else I was going to say that I don't remember. I guess also I had to work through like the risk management group in the county government and had to get their sign off. Essentially, they were more concerned with like people walking into the street and getting hit by a car and stuff. So I did have each host sign an agreement, not like it's legally binding, but I had like, you know, a list of things to follow, what to do, like don't hold these at night, or, you know, whatever, don't encourage people to stand in a dangerous place. But that's kind of, yeah, those were the safety things that I did for this one. We did get some good feedback that we'll incorporate for the next, because people are telling us we need to do this again next spring.
That is so awesome to do a campaign and have people request it again.
Oh yeah, some
Yeah.
people just want to do it next month. They don't want to wait a year.
Wow.
So
Well,
yeah.
Well, Zev, thank you so much. And talk about jumping in just a few months ago and getting things going with both feet. You know, this webinar moves us in a lot of different directions. And, you know, going from Zev kind of focused on the signs of hope and how do we message effectively about this work. I'm going to move now to actually introduce Iden Campbell, who's going to share something about a summit that's happening this summer that's looking more at sort of what does it really mean for us to look at suicide prevention from a social justice perspective. And Iden Campbell, if you don't mind, I will bring you on.
Hey, Annette.
Hey, Iden.
All right. I won't get on camera because I'm driving, so I'm already illegal enough. But hello, everyone. So this is the second annual summit. Last year was our first summit in July of last year. And last year focused on Black and Indigenous people during COVID. So we basically did it online last year, and we had a little over 100 people actually attend the summit, and amazing amount of registrants, over 350 people registered. But you know how people get zoned out. So this year we're doing it in person, but we're going to do it hybrid. So it'll be in person. We're limiting the number of attendees to 100, and we'll also have it on Zoom which means that we could have up to probably 200 to 500 people on a Zoom platform, but I need to see what package I have. But either way, we'll be able to fit quite a bit of people onto the Zoom platform. So it'll be a town hall / summit, and we'll have an opening speaker who is Ebony Clark from Multnomah County Department of Behavioral Health, and Canada Taylor Parker, who will be the closing speaker. And Canada is similar to what Zeb does in his county, she does in Multnomah County. So Canada will close out and talk about the work that she does with Postvention around youth suicide. And our keynote speaker is Lacey Kendrick, Lacey DeCarey Burke. And Lacey is from Baton Rouge, Louisiana. And she'll be talking about her experience as a young person growing up in foster care, aging out of foster care, having several attempts while she was in foster care, but also aging out into not a supportive system, and how that also caused her to continue to think about suicide and then also become addicted to alcohol. So Lacey will talk about that from her perspective as well, from a social justice, human rights lens. Lacey does a lot of work internationally around youth and foster care. So she'll bring not only a lens around, the States, but also internationally, what people are doing, across the world for suicide prevention. So we'll talk a lot about, and it'll be a lot of new terms that a lot of people are not familiar with, like, being anti-carceral. What do the systems, how do they impact youth when they're in the carceral system? And so for us, the carceral system means juvenile detention, after school detention, prisons, even foster care. So any of the systems that youth and young adults are pushed into because they may have mental health concerns or, addictions. And then you have the self-harm and the suicidal thinking on top of that. A lot of times youth get pushed into systems because of that. So we'll talk about being able to break down those systems that actually cause harm to our youth, and how can we come up with some solutions to keep youth out of those systems. But if they are in those systems, how can we make those systems healthier to support youth? I know that was a lot. But the summit will be on July the 21st from 10 to 4. And we're looking for a location now. So if anyone has any suggestions, please contact Annette or myself to let us know.
Aiden, thank you so much. And for doing this while you're driving between places. I don't know if I should encourage that behavior or not, except that I just really, really appreciate hearing your voice and vision. And I just want to pull out a couple of the questions in the description that I just think are so powerful. How do we keep our loved ones rooted in community when they no longer feel they want to be on this planet? How do we support our community members navigating suicidality while holding space for all the ways it makes sense to want to die? Something we don't talk about much in our suicide prevention world is that there's real reasons that people are hurting so much. And then how do we support each other? How do we support autonomy while also creating the systems? I just think it's going to be a really rich and exciting conversation. And right now we are sending save the dates, and there will be links to register. Please, we will send out with this my contact, Aiden's contact. I know that we would love your engagement and involvement with this. And I'm super excited, especially because we're really aware that young people who are in child welfare, juvenile justice systems, et cetera, have so many intersecting identities that add risk, but at the same time have like this incredible wealth of ways that they have learned to survive and move forward. And we really need to be listening to their voices in our field. So Aiden, thank you for organizing this, and we will keep folks posted.
Okay, thank you. And we'll get the flyers out today. I actually finished them up, so we'll be sending the flyers out. shortly.
Fan-
Anything-
Fantastic.
All right.
So before we shift on to Leslie, who's going to talk with us about 988, I actually knew Aiden was here just for a real short period. I want to circle back and give Zev just like 5 more minutes because he wanted to share a little bit more about the messaging campaign that was so exciting. And then we'll move to hearing from Leslie, and we'll close our time out focusing around LGBTQ folks and suicide prevention.
Okay. Oopsie. Current slide. So I just quick wanted to talk about some of the logistics of the mental health awareness videos because I would love to see other counties kind of use this idea for making some, public video for their own purposes. Doesn't have to be the same question or anything. But so the big thing that made this all possible, that second bullet there, is that we had a TV studio in Washington County, which is kind of a quasi-public organization that there apparently are more of across the state, which they get money from the county government based on uses of cable TV, because the cable TV providers need to use infrastructure that the county owns essentially. So there's kind of an agreement, and that money can be funneled back into providing kind of a community studio where people can do their own filming, or they can use the studio to help with editing. So we did both of those things, and we ended up getting 34 people to participate in these videos. The videos were intended to kind of give them a couple different prompts, as you can see here. This one was used for the mental health awareness videos you might have seen that the Oregon Alliance has shared and whatnot. We also asked them a second question. What would you say to a friend who may be thinking about suicide, which we're thinking of putting together for September. And then I also just kind of started asking them a third question, asking them essentially, is there anything else you'd like to say about mental health or suicide to your community, whatever you identify with, or the world at large? And a lot of people had some really insightful comments. I would say on the whole project, the best footage, the best commentary was in this open-ended prompt. And I'm trying to figure out how to use it, because there could be lots of different opportunities to kind of share this with the community of Washington County, the state of Oregon, kind of just to help people feel more resonance in the way they feel about the world. We did our best to get different participants recruited, and the recruitment was kind of organic in nature. I encourage you, if you are interested in doing this, to kind of just use your existing connections and ask them to refer people they think would be interested, and continue that process in kind of a snowball. That's what we ended up doing, and more people kind of jumped on the idea. It started out feeling really daunting to even recruit 20 people, but I think especially right now with COVID finally waning, people are feeling the effects, that the suffering that has taken place with that, and are wanting to share their ideas with their communities. I'm not going to play this because there's other ways to see it. Just wanted to really quick share that we used a lot of the budget from the current fiscal year for advertising, and there was a couple lessons learned here. First, we did some video ads, which was the bulk of the purchase for the consultant, and then a little bit for display ads, and then a little bit for Facebook boosting. By far, the most effective was the streaming TV. And I can connect you with the same consultant if you're interested. This is the kind of thing where you're on like a a network provider like Samsung TV or Roku or something, and they just kind of share advertisements along with their programming. And the only way to really avoid them is if you change the channel or turn off the TV. So you're expected to get really high view rates. As you can see, you're 97%, which means that the view is very cheap to provide. Because if we're, as this says, 86,000 impressions, that was 7 cents per view. And that included some local TV as well. YouTube was not a good choice. We got the same number of impressions, but with YouTube, it's very easy to skip. So we only had about 4,500 views, which is a 5% rate versus 97%. So each view almost cost $1. Not nearly as good. These were some of the display ads. I also made them with Publisher. It was a little annoying to make them based on a pixel size with the requirements of the consultant, but I can help you if you're wondering about how to do that. They're in English and Spanish, very basic messages. And for these, they're very cheap from an advertising cost standpoint. We got over 1 million impressions of these ads. And these are the things you see on a website when you're scrolling down a page. And usually there's some annoying pop-up about buying a new pair of shoes or something. But with these, our click-through rate, even though it's so low, seemingly at 0.15, is actually double the industry rate, probably because the messages on these are much more important to people than selling something. And another important point here, some of these sizes were up to 9 times more effective than others, which is something I'll just remember for the future. And finally, with social media, with those 2 hashtags you saw on the signs, we tried to do some boosting of posts and also just asking people to post on their pages. This is a handful of the pages that posts were put on. The English hashtag got a lot of great activity, hundreds of different reactions and comments and stuff, 13 posts, but the Spanish one did not. And I'm not super sure why that happened the way it did. I need to review it a little more. But in summary, using hashtags can be a good way to kind of further the messages beyond paid media sources.
Well, Zev, that detail is so interesting. And, you know, we're putting together these media packets to share out with everybody in August. And you just added a whole bunch of context and information I would never have thought about around a lot of the, you know, things to think about. And that 1 million hits,
Yeah,
that's pretty incredible to hear. So thank you so much. And Zev, do you mind, if people reach out to you with questions?
yeah. I want to be a resource because this is my first time diving into this advertising world. So I'm happy to just share whatever questions may be asked.
All right. Well, thank you so much. I will now, we're going to shift gears again a little bit to hear about 988 from Leslie Golden, who is part of the Alliance in our executive committee and at Lines for Life.
Thank you. Hi, Zev, I just have to say, both you and Ivan, what inspirational and amazing work in such short order. It's so impressive to hear about how much you've done in such a short period of time. I'm Leslie Golden, she, her pronouns. I am on the executive team at Lines for Life. I was also a former board member for a number of years before joining staff, which is one of my greatest privileges. And I've talked with quite a few of you before as I've been on the Alliance for the last, absolutely, since I've been on the Alliance the last, I think, 2 years now this summer, which is amazing. So here's what I am and am not going to do. I am going to give you a very kind of simplified look at 988 right now. I am very purposefully keeping it really refined and kind of reduced to how we are looking at it in the short term. But I also, when I finish, am going to be giving you what I believe is not an inaccurate long-term vision for what we hope 988 ultimately facilitates in Oregon and across the country. But what I wanted to do and what Annette thought would be helpful is just is to talk a little bit about where 988 is at, what it's going to look like July 16th when the phone number goes live officially. And also what Lines for Life as a call center is doing to get ready for that, because it definitely has some significant impact on us and our operations. So what's 988 going to look like in July? Well, it's going to be adding text and chat to a number of call centers like ours, in addition to the typical calls we've been getting on Lifeline for years now. The only difference is on July 16th, if a call comes into 988, it will look exactly like a call that comes into the NSPL Lifeline 10-digit number. So they're going to get farmed out to any of the call centers that are part of that NSPL network, as we have been for many, many years. So we are busy. Sorry, let me stop on that. Yes, thanks, Jen. NSPL is the National Suicide Prevention Line, which is the talk number right now to reach crisis line help. So contact, respond, and go to are really the core tenets of initial 988, right? So contact will be call, text, and chat. Respond means taking any of those contacts, the folks that are reaching out, to de-escalate, to provide resources, and to offer to follow up with folks if they want that. So very straightforward. And again, what we and Northwest Human Services have been doing for a very long time. This is just an expansion, but continuation of those things. Going to or mobile dispatch, we're going to talk a little bit more about as we move forward. But currently, how that happens is not going to change. Right now, if we get a call from someone who is, say, in Jackson County, we believe that they need 911 dispatch to them. Right now, what we would do is call the PSAP or the 911 center in Jackson County and let them know that someone needs intervention, physical intervention. Now, for all the reasons everyone knows, we want mental health professionals providing that physical presence with folks if they need that kind of intervention. So over time, for the counties that are already doing it, what we hope to be able to do as a state, obviously, is to provide mobile dispatch that has mental health, behavioral health intervention trained individuals that are going by way of 988 to show up and help folks that need physical intervention or transport. So those are really the three core tenets, right? It isn't in principle different from what we're doing, but it is the underpinning of enormous reform over time. And I'll talk a little bit more about that, but first the short term. So purely from the Lines for Life perspective, I will say as part of the internal operations leadership team, our focus has been for months now on finding, recruiting, and hiring behavioral health clinicians who can add support on the lines, both on the 988 line as it goes live, but also on the text and chat system, which is a new platform that we'll be using. And so lots of HR work in hiring. Many of you know that hiring behavioral health specialists right now is very, very difficult. It's difficult in Oregon, though we are hiring staff around the country. It's one of the changes that COVID brought us, which is great for us and great for contacts that need us. But nonetheless, the pipeline is very, very difficult to tap right now. And so we are nonetheless hiring between 8 to 14 or 15 clinicians a month and onboarding and training them. I will just say quickly, as an organization that 2 years ago had 138 people, we are now at 260 and growing. I cannot emphasize enough what it's like to be a very small and then a medium and now growing into a large service provider. The operational challenges of that are significant. So we are trying to mature and or change the wheels on the bus as the bus is speeding up. And so lots of lessons and lots of kind of continuous improvement for us because this is a very significant undertaking for all of us, but we're determined to meet that need. So staffing, training up, and then operationalizing growth. It's not like we've had a chance to learn how to operationalize before the growth. So we're doing this on the fly, frankly, learning every day from the things we're doing well that we repeat and the challenges that we face that we're improving. We also have a seat at the table for the national conversation, which is with Vibrant, hosted by Vibrant, right, which is kind of the administrative arm of 988. They run the call center network for the National Suicide Prevention Line, and they are currently working on the technology that they intend to be a big platform that will be both behavioral health, health record system, a CRM, and also a phone system. And they're trying to integrate those two along with text and chat to become a single platform. I will only say that that is moving. It's moving slowly, but we are at the table and learning a great deal month by month on what their intentions are for the early versions of that big system, and over time, what they hope to be able to provide the nation and all call centers to have access to. And I will just say this, of all of the components of that national system that they have just started building now, the phone system is the single greatest advent if centers around the country are willing to move all of us onto that phone system only when it's ready, which frankly, in what we would need it to do will be years from now, probably. But when it's ready, it will allow a much faster, much more seamless time to answer calls. And that is the greatest reason and incentive for any of the current call centers to even consider doing it eventually, because it means if you're calling, you're not going to have to wait for it to go to the national number and then get sent over to one call center. And if there are no agents available, to another one. It means that that national center or that hub can really see any agent available across the country and send a call to them without delay. So as we look at what we're willing and able to do short-term and long-term, our greatest interest and view is to the national phone system as it's getting built. Again, we don't believe that will be ready for us for a number of years, but over time, we're hoping that that is the single greatest reason for us to make that kind of big system move. And I'll stop talking about the tech, but I just want you to know that we do have a seat at that table. We're involved in it weekly, monthly, and hoping to keep our eyes and ears on that kind of progress and influence it as much as we can, along with about 17 other centers around the country. And then in the short term, right now, we are merely at the table. OHA and the 911 PSAP network really own the development, design, development, and evolution of what will be an integrated dispatch system. And I'm gonna not go too far into dispatch, except to say this. Lines for Life is not a dispatch center, and we are not queued up to be a dispatch center. And we're grateful to be at the table to listen and learn and try to help offer discussion and advice about ultimately what we see around the country as the few states that have a fully integrated system where, and I'll just state this quickly. I want you to imagine, if you haven't seen a model for this, that I'll go back to Jackson County just because. A youth in a very dire crisis reaches out by text, which is the most likely for youth, as many of us know. They reach out by text or chat, and we will know very quickly whether it's high acuity. And so the idea is, wherever that text or chat comes into, the system itself, which has all of the PSAPs having access to the same information. Let's say Jackson County has its own dispatch unit with a behavioral health trained clinicians. We would ping them, they would see that there is a youth with high acuity that is home alone, and within moments, we can let them know that we think there may need to be a dispatch. They can get their dispatch unit ready. And with a push of a button, that local dispatch unit in that community that knows their folks will have access to all of the information and be able to go if physical intervention is needed to keep that child safe. So the idea is not that we're running all the systems, because we won't, we never will. It's that everyone that needs to be involved at the very small community all the way up to city and county level has access to a system that is tied in for real-time information, so that the gap in time for intervention can be shortened as much as possible. So in the long term, the idea is, I would guess as a technologist, 3 to 5 years from now, we'll start seeing that kind of system tie-in come to fruition. But it is highly complex. And we're also talking about some very old antiquated systems that would need funding and a big boost to be able to then tie into modern systems. So that is something that is getting worked on. OHA really owns that, again, with the PSAPs and the 911 system. But we're at the table along with Northwest Human Services to really try to help stay in the conversation and be as supportive as we can with what our systems look like and how ultimately we can be of service in that. Long term, I want to just talk quickly about sustainability. There are 2 critical pieces of long-term 988 stability or sustainability. Certainly there are federal allocations that come down to the states that are taking on this work or expanding to be able to grow with the demand. That means that Medicaid billing, which some states are already doing for this, would become an integral part of tracking and going through OHA, so that there are reimbursements that help us provide more clinicians to answer more contacts for folks in need. So Medicaid billing is part of what's going to be looked at, and the systems that would need to be in place to make that possible for the state of Oregon. And then the second piece is, some of you may recall in the short session, an effort to get a very small fee, which unfortunately got called a tax, by cell carriers, so that this system would have some long-term stability, was defeated in our legislative session. But for the long session coming up, that will be reintroduced. And it will be fought for pretty hard tooth and nail. It is a critical part of this. We are talking about a very nominal monthly ad of about, I think, either 10 to 25 cents a month. And the goal is that that would provide, honestly, millions and millions of dollars for the many different facets, the least of which right now is technology. As many of you know, particularly with youth, it's about creating safe spaces in local communities as interim places for youth and also for adults that are in serious crisis where there aren't other services already. So let me take a breath. And then I just want to mention quickly, just to go back to my discussion even about dispatch, what I think becomes possible with 988 over time. I am not looking at the chat. Are there any questions at the moment? If you want to put a few in the chat, I will try to address them. If I don't have the answers, I will be straight up that I don't. Okay, I'm not seeing any. Is anybody else seeing any in the chat?
I'm not. I think, Leslie, what I appreciate about you sharing is, I think we're all hearing about 988, or many of us are hearing about it from many different angles.
Mm-hmm.
And, 911 has been around for how many years now? And it's such a complicated system. And I think one of the things I'm wanting to do is really try and help manage expectations for people and sort of trying to think about what is the advice to all of us in this field about how much we should be, should we, as of July, be moving to 988 is completely the number we're promoting. I think I just would love a little thinking about that, and curious about what others are doing about that as well.
Yeah, I would love to hear from some other folks, particularly if you have felt uninformed, confused, like you've been getting mixed messages, concerns about it. I am pretty grounded at this point about it and feel comfortable because I understand that this is going to be an iterative opportunity. And so I'm really comfortable talking about what I think is likely in the first year or two versus what I think the potential is. And it's very important to keep those two things separate. So I'm open to hearing from folks.
Great. But the reality is that we can give 988 as a number and it will get folks to the National Suicide Prevention Line.
Yeah, absolutely. Absolutely. And again, calls coming from within Oregon or from an Oregon area code, calls themselves will come to Oregon no matter what. They'll come to us or they'll come to Northwest Human Services. Texts and chats. I think chats are actually the first question that's asked with a chat, no matter where it's coming from, is the zip code that it's originating from. And that gives Vibrant, again, as the administrative hub for the country, it gives them an opportunity to then send that chat to a text chat center where that zip code is. So it becomes a regional state level response, which is great. So you know, I will jump then to what I believe, and this is me talking regardless of where I work, and Annette and some of you that I've been in meetings with over the last couple of years, I think are probably used to me saying this. My background very quickly is in working statewide and working nationally, looking for ways to build systems that help improve service. I did that in K-12 education for years. And the reason I bring that up right now is when I look at the potential for 988, when I look at the potential for behavioral health care improvement, and I will just use one particular vein in this, a longitudinal data system is longitudinal in that it tracks the experience and the needs of a child all the way up through their adulthood. And when I think about what a unified system in Oregon and even nationally could provide in terms of mental health intervention and support and postvention, if we were able to track a youth that struggles in Oregon and help keep the support and the interventions and the care they receive and outcomes of that care in a system where caregivers and where policymakers, and by that I mean healthcare providers that are influencing policy, can truly get real-time information to improve how we take care of each other. That to me is revolutionary. And so when I look at the potential of 988 and I come at it from a technical perspective, and I know with folks like Alyssa and others who are researchers, I get so hopeful when I think about what 988, by unifying systems and unifying conversation, all of which helps destigmatize and normalize what it means to have physical and emotional health issues, one and the same. I look at the formative power of that, and I look at the potential to create a common language and a constant improvement in how we take care of each other around these issues. So the long-term vision for me is 5 to 10 years from now, I would expect the conversation about mental and behavioral health to be profoundly different, to be matter of fact in the ease with which our youth, for example, it'll be harder for those of us that are older, right? But for the purposes of the future, helping support youth to come into a society where it is as comfortable and matter of fact to talk about the fact that you are ideating as it is to say, I twisted my ankle at soccer practice, right? So I am not Pollyanna about anything, as the folks at Lines for Life that are on the call can tell you, but I see the potential, and that's part of why I am so deeply invested in helping Lines and helping OHA and helping all of you as best I can behind the scenes to really make this happen. I am fine with the fact that it will not happen overnight. I don't expect anything ever meaningful to happen overnight, but I do believe in the long game. And I will just tell you that staying engaged and watching for information and continuing to do what each of you does in your own part of this work is what's going to get us there. So that's where I am.
Well,
And
Leslie, thank you so much. And I love you sort of laying out that vision for the future too. And I think that's part of our hope, help, and healing messages is like, okay, we got to keep that big vision out there of where we're going, because there's going to be a lot of messiness between here and there.
Totally.
Donna Marie had a question, and then I
Mhm.
want to be sure that in the next 5 minutes we switch gears over to talk about LGBTQ.
Thank you. Totally.
Hi, Leslie. Thank you for this presentation. I came in a little bit late, so I'm going to say that this may have already been addressed.
Mhm.
But I know a number of counties are keeping their crisis line numbers open as well. And I'm curious how you feel that's going to fit in with 988, if that's, especially when we're looking to get this longitudinal like information, like, is that something that you support? Do you think that that's very important for right now? Or do you see it being phased out in like 10 years, that county crisis lines won't exist and it will just be 988? So yeah, I'm just curious where you see that fitting in.
So I will say right now that the counties are doing beautifully what they're doing with very little resourcing, right? I think the only significant change, and this is me talking, sitting at different tables, but not being a driver. Over time, the only change I see is that calls may come through a main call center, but it's still going to go right to those county centers if they have dispatch, right? That's the whole point, is to get that time gap as small as possible for the highest acuity that can't be de-escalated without intervention. So in the short term, things will stay as they are. There's just going to be 988 instead of the national 10-digit number. Counties that have those direct services will still get those calls, although we do after hours answering for many of them, right? Over time, the only difference that I would see is if a 988 call comes in, it may come in through us, but it would immediately get directed to that county that is still providing those direct services. So short-term, no change. Long-term, only after a lot of work together to be sure that all we're doing is providing the fastest service as a collective to folks in need.
Great.
Thank you.
Totally. Yeah, I
Leslie.
really appreciate the time too. And Annette, thank you for inviting me to talk about it.
Really appreciate you being here.
Totally.
So I didn't come up with a smooth transition between these items, but June is Pride Month, and our LGBTQ community is incredibly important, and just wanted to highlight a few things that are happening around the state and some thoughts about how those of us in suicide prevention can really be working to address suicide in our community. And so I'm going to just share a couple of overview slides, and we'll close out our session today with Chris Bifulco sharing information about a mini grant project that happened across the state, and a sample of one of the videos that was created from it. So just in terms of how do we think about suicide prevention in LGBTQ communities, this is not an official researched methodology piece here. This is like a model that we at the Alliance have been playing with as a way to really understand kind of the scope of the kinds of things we need to do to support LGBTQ plus people, youth, families. And we've really begun to think about our approaches as everything from harm reduction. So this is interesting. If you think about harm reduction, it's about protecting people from things that are going to harm them, to providing primary prevention, appropriate supports and interventions. And then we think very, very important part of it is this individual and collective empowerment and transformation and culture change. And just to be clear, I think many of us, as we do our work, find ourselves in one place or another along this continuum. But there is space for suicide prevention, intervention, and postvention work in all of these spaces here. And so just talk about a little bit about why that's important. Next slide. So what do we know about suicide in the LGBTQ community? First of all, I really, really like to start with this. Most LGBTQ folks do not become suicidal. And increasing protective factors is more effective than decreasing risk factors, which there's a whole lot of implications about what does that mean for how we do our work. We also know people can and do recover from suicidality. I'm including that because we're about to jump into some stats that can be alarming. Also, that effective treatments and approaches exist outside of inpatient hospital settings. So, you know, one thing about my queer community is that we are really skilled a lot of times at community care because of our history of having been separated from families, et cetera. And we have learned a lot about how to lean in and support each other. I think that the LGBTQ community and many other communities that have experienced depression have a lot to teach us about what community care means and how we work together. Just a note about the data, we know that it's very hard to get data around the LGBTQ suicides. We're getting some better data, but a lot of the coding, you know, whether people are identified as LGBTQ or not is really variable across the country and across our state. Next slide. I want to highlight a couple of things you may all have seen that Trevor Project just did a huge national survey on LGBTQ mental health. And I've got the link to the survey up here. Just a couple of things that really bring home why we in suicide prevention need to be thinking about this. 45% of LGBTQ youth seriously considered attempting suicide. And nearly 1 in 5 transgender and non-binary youth attempted suicide. And LGBTQ youth of color reported higher rates than their white peers. And so, again, we see when there is an intersectionality of oppressions, of you know, societal stressors, we as human beings have a hard time managing that. It sort of goes back to that question Aiden was saying is, what do we do when people feel despair for some real reasons and we need to address it? I'm just gonna pull out a couple of other things. So they also found that LGBTQ youth who felt high social support from their families reported attempting suicide at less than half the rate of those who felt low or moderate social support. And LGBTQ youth who live in a community that's accepting report significantly lower rates of attempting suicide than those who do not. Both of those to me are real messages to us in our field around what's the world we want to create that LGBTQ folks feel welcome in, feel affirmed, feel like they are part of the community and are supported. Very important. School setting, incredibly important. Next slide, please. Just a couple of more Oregon-specific stats. This is from a presentation that Oregon Department of Education did. But the way young people think about themselves, their sexual and gender identity is really shifting. About 1/3 of Oregon youth are identifying as gay, lesbian, bisexual, unsure, or something else. And about 8% of youth are transgender or gender expansive. Next slide. Because we do so much work with youth, I think a lot about school settings, and that's why I brought some school stats along. But these two slides really kind of share some of the conditions that impact long-term health outcomes for LGBTQ youth and really can impact suicidality. As a result, work to create affirming environments at school and home become incredibly important. And we need to have a variety of strategies for doing that. Next slide. One strategy that we at the Alliance have used is really to try and support OHA and push OHA, the Oregon Health Authority, around taking very public stance in opposition to kind of the onslaught of anti-LGBTQ legislation that's happening across the country. The Alliance sent a letter to OHA. They responded at our quarterly meeting with a press release that they are sending out for Pride Month that highlights a lot of resources and supports for LGBTQ youth and affirms their support for LGBTQ youth and their families. But as an alliance with Policy Eyes, we're going to continue to watch carefully, especially as we move towards this next legislative session, where it's likely that some of the kinds of legislation that there has been across the country that do things like reduce access to gender affirming care. Sometimes, for example, in Texas, parents can be taken to charged with child abuse for providing gender affirming care, et cetera. We think it is likely that there will be folks who will try and either introduce that at our legislative session or make attempts at the level of school districts, local communities to implement policies along those lines. And we really are wanting to be sure that we are very clear about these being the research evidence-based items that really support LGBTQ youth. Next slide. So I just before I switch over to Chris, I really want to encourage you to learn about Addie's Act in your community. So Addie's Act is Senate Bill 52 that requires every Oregon school to have a suicide prevention, intervention, and postvention plan. It acts in conjunction with a whole bunch of things called Student Success Acts. These basically are initiatives through the Oregon Department of Education that address a variety of specific communities around how do you create an affirming school environment. And it looks at everything from curriculum to what does your school facility look like. And I particularly highlight this because I think this is a place where we can really support our local schools in doing this work effectively, because they could write a plan that says, here's what we do in case of a suicide, here's the training we're going to do around suicide prevention, here's the plan around if somebody dies, but never actually take a look at what the school environment is saying in terms of affirming the students, including students of color and LGBTQ youth. And so really encourage you to be asking at your local level, at your school board, your school district, some good questions about how their suicide prevention and intervention planning is supporting these specific communities. When you get the slides from this, you will be getting slides of several other kinds of resources that are in Oregon. Jen, can you just flip through a couple more forward? Let's hear this. There is a slide that really talks about what a whole school looks like that has LGBTQ2 SIA inclusive practices, some resources about family acceptance. Next slide. And I especially want to point you to this website, www.oregonlgbtqresources.org. This was designed especially for families and has resources around the state and is really designed so a family that is not being as accepting of their child is given a lot of resources and language to look at and think through that might help them shift towards being more protective. Just one more slide. So it shows specific examples like this of ways that you can be rejecting and increase health risks. Next slide. And there's examples of ways all across Oregon we are supporting and affirming LGBTQ folks. So that Open Mind, Open Heart was from PFLAG in Florence. That other one was from Central Oregon. All over Oregon, communities are stepping in and supporting their folks. I'm going to pass the baton to Chris Bifulco now, who is going to share with you some highlights from a project that she led over the last year.
Thanks, Annette. So I'm here to share a little bit more about our LGBTQ mini grants. My name is Chris Bifulco. I use she and they pronouns, and have been leading this effort over the last actually 2 years. And if you'll excuse me for a second, I need to get out of presenter view because I wrote up my comments so that I would be brief. And you know what? We might just have to do it this way. So I wanted to take us back to 2020 with the start of COVID and the pandemic. And this is really where this project started. With the support and funding from OHA, the Alliance was able to develop a low barrier mini grant program to help mitigate the effects of COVID on priority populations who are at increased risk of suicide and also disproportionately affected by the pandemic. We chose to focus on LGBTQIA2S+ communities, and through the work of the Alliance's LGBTQ advisory group, we're able to put this program together. And we also gave priority funding to LGBTQIA2S+ communities of color, those working with or from disabled populations, rural and frontier communities, understanding that all of these populations are at increased risk for things like job losses, loss of access to care, loss of social supports, and increased isolation due to quarantine and other COVID safety measures that we were dealing with at the time. So we put out an RFP that specifically asked groups to consider applying, even if they didn't see their work as being part of the suicide prevention realm yet. We thought that just because these groups existing to serve queer communities are doing suicide prevention work, and we wanted to help folks see that and to partner with them that way. We asked for projects that help build protective factors and were grounded in local work and energy, reflective of and attentive to diversity in their community, trauma-informed, COVID responsive, and we specifically called out for small out-of-the-box projects. Nothing was going to be too small or too big for us to consider. We just wanted to make sure that it would work for that community. And in this little slideshow that I have for you, I have some quotes directly from grantees from their final reports, and this one that I wanted to start with is just really speaks to why we prioritized our funding in the way that we did. This grantee said, those of us living at the intersections of race, sexuality, and gender often find themselves confronted with the very real struggle that suicide feels like the only available option. So through our program, we were really seeking to support protective factors. Like Annette said, that's often more effective than reducing risk factors. And here are some of the protective factors that we're focused on throughout our projects. The RFP received 81 applications representing 30 out of 36 counties throughout the state. For the first round of funding, we were able to fully or partially fund 18 projects statewide, and you can see what some of those activities were for those projects. And grant recipients, you can see here kind of the distribution from our first cohort throughout the state. They also had the opportunity for evaluation consultation through Oregon Health Authority's Program Design Evaluation Services. Trauma Informed Oregon offered webinars and open office hours to help projects be more trauma informed. And in the 9-month grant period, we saw grantees reach about 4,500 people throughout the state. They engaged 123 unique partners and were able to raise an additional $160,000 for program sustainability. The next few slides have some quotes from grantees. I'm not going to read these aloud. I'll let you do it while I talk a little bit more. One of the things that we saw from the success of this first cohort were some of these impacts here. And the successes brought more funding into the program. We received additional funds through OHA's GLS, Garrett Lee Smith Youth Suicide Prevention Contract, and that allowed us to offer some sustainability funding to the first 18 grantees. You can see here more positive impact on staff in those cohorts. And then we were able to onboard an additional 5 projects at our full funding amount, which was $20,000. And that was another 9-month process using those funds. And so we just closed that out, I think, in February. And through the second cohort, we saw another 5,000 individuals reached. We saw another 85 partners engaged, and an overwhelming $638,000 that were additionally raised to support program sustainability. And what that really translates to over the last 2 years, in addition to the seed funding we were able to put out through the Alliance in partnership with OHA, means that over $1 million has gone out to support this population in our state in the last 2 years. And what that has translated to are all of these things that you're seeing here with these impacts and these effects, but also these mini grants were largely used as seed funding for programs. Additional funds has really led to true sustainability. Some mini grant programs have been able to hire staff for the very first time. They were volunteer-led grassroots programs and now have staff and funding. Some of them became permanent programs at their organization. Many have been able to keep their local LGBTQ community connected throughout the pandemic. Some final reports said that this was the only way that local queer groups are able to stay together and stay in contact throughout the pandemic when no other options were available. And really beautifully, what we've seen throughout the state, some amplified impacts, is that many, many communities were able to host their first ever Pride celebrations in 2021. And we're hearing that they're coming back this year, 2022, June, July, and August, to host their second ever Pride celebrations, which are coming up. And we know that those really do build on community protective factors and resiliency, and really celebrate who we are in those communities. And in addition to that, we are seeing some of these grantee programs joining local coalitions, and that sort of interplay between our Pride celebrations and local coalition work. I know in Klamath, for example, one of the grantees is a big part of their coalition. And this year's Pride celebration in July, they're doing a raffle, and half of the funds will go to Pride 2023, and half of the funds are going to the You Matter to Klamath Coalition to support suicide prevention. So we're seeing kind of a reciprocal giving and receiving of funds and of community building and sharing. I know we have a minute here. I'm also hoping to share a video at the end if folks can hang on for about 8 minutes to see what one of these projects is able to put together. But I also really wanted to thank the Alliance for supporting this work. We really couldn't have done it without the Alliance and without local coalitions. And though the program's over for now, we do have, in terms of the funding, we do have a 5-year CDC grant to look at ripple effects and additional impacts from this mini grant program. Place Matters Oregon is also going to be producing a video featuring some of these grantees that really shares with a wider audience how place and community building leads to healthy and thriving communities. And the model that we created for this is being used for other mini grant programs throughout the state, because we've seen so much success with letting communities lead first. And I think this includes some of the upcoming coalition's mini grant funding. So if folks can hang on just for about 8 minutes, I wanted to share a video from a group called Beyond Boom and Bust, and you can go to their website, beyondboomandbust.com. Their project was a storytelling and dance project where they put a call out for stories, asking folks to share the story of getting through a hard time and any song that helped them get through that time. And they paired the storytellers with choreographers to create live performances. And this is one of the ones that we'd like to share today. And all of the videos that they have from Outdance Project are available on their website.
Yeah, thank you. And I know many of you may have to leave, but we're going to leave it open. And Chris, thank you so much. And we will also provide the link to this as well.
Great, thanks.
Hi, I'm Casper. Throughout my life, I knew that I was different. I grew up in the South. I was raised Southern Baptist. I'm a transgender male. My mother didn't allow me to express myself in the ways that I needed to. She would tell me, "That's not ladylike," or "Girls don't do that." When my brother got trucks and cars, I got Barbies and dolls. A mishap with some hair clippers on my part, and I got the short hair I wanted. She forced me to wear pink and got mad when people mistook me for a boy in pink. I felt like that was correct, though. I'd come out multiple times in my life, bisexual. There was a point I thought I was a lesbian. I even thought I was asexual. I was unable to talk to people that would accept me for a very long time, no matter what I was trying to convey. I was confused about things because there wasn't a way to express myself without others getting mad. My mom was the one that shut me down the hardest. All her family are the same way. The last time this happened was when I came out as transgender. I am a man. This is me. I've been told by people that I had relationships with that they would rather not talk to me and that they didn't sword fight in order to keep me from transitioning. I've been told, "You're dead to me," by my own mother because of who I am. My little brother no longer talks to me, and I haven't had a voluntary conversation with him in years, not by any choice of mine. I reach out constantly. I was forced to continue being girly, so I tried to live with it. There was a point when I tried to be hyper feminine, and I dove headfirst into makeup, pastel colors, skirts, and dresses. I tried for years after high school to stay like that, but it hurt. It hurt, and I hated it. I got to the point where I didn't want to live anymore, so I got help through therapy. In this, I found comfort, and again, I felt like I knew what I needed to do. I've been harassed, I've been bullied, I've been the silent weird kid, I've been the abomination, and I've been told that I am going to hell by the people I thought that were supposed to love me unconditionally. This Is Me resonates with me so loudly I cry every time I hear it. From the moment I put on my first binder, the moment I went to the barber for the first time, the moment when I had a conversation with my fiance who happens to be trans as well, and we both didn't know until then, the moment I went to get my name and gender marker changed, the day my dad finally used my pronouns. I've also found myself, my chosen family, and real love by being authentically me. I've overcome the biggest mountain. I've found what and who I'm meant to be. There is no one and nothing that will stop me. There isn't a person I can't face, a fear I can't conquer. I am proud of the person, the man that I have become. This is me.
I am not a stranger to the dark. Hide away, they say, 'cause we don't want your broken parts. I've learned to be ashamed of all my scars. Run away, they say, no one will love you as you are. But I won't let them break me down to dust. I know that there's a place for us, for we are glorious. When the sharpest words wanna cut me down, I'm gonna send a flood, gonna drown them out. I am brave, I am bruised, I am who I'm meant to be. This is me. Look out, 'cause here I come. And I'm marching on to the beat I drum. I'm not scared to be seen. I make no apologies. This is me. Another round of bullets, it's my wanna drown a mind. This is brave, this is bruised, this is who I'm meant to be, this is me.
Thanks to everyone who hung on for that. And thank you again for the support and for letting us share. Happy Pride, everybody.
I'll just hang on here for anyone who wants to talk. Chris, thank you so much.